Let's start with the basics. Think of VO2 as the engine size of your body's ability to use oxygen. V stands for volume. O2 means oxygen. VO2 max is the maximum amount of oxygen your body can take in and use during intense exercise, like the top speed of your metabolic engine. More oxygen equals more energy, so you can work harder or longer. It's measured in milliliters of oxygen per kilogram per minute. A higher VO2 max generally means better cardiovascular fitness. It's a gold standard measure of aerobic health. So, where does a MET come in? A MET is a simpler way to express energy cost. 1 MET is the energy used when you're sitting quietly. 3 METs means 3 times resting energy. METs are easy to look up for most activities. Walking the dog, vigorous swimming. Let's put this into real-life terms. Sitting on your couch equals 1 MET. Walking your dog casually is about 3 METs. Running moderately is about 8 to 10 METs. VO2 max is your ceiling, the highest METs you could sustain. Example, VO2 max 70 milliliters per kilogram per minute is roughly 20 METs for an elite athlete. So, why should a busy physical therapist care about these numbers? Because they are powerful tools for communication. Because they are powerful tools for motivation. Because they are powerful tools for safety. When you tell a patient to do moderate intensity exercise, what does that actually mean to them? It's subjective. But if you can say, aim for activities in the 3 to 5 MET range, like brisk walking or light cycling, that's a concrete, actionable instruction. It removes the guesswork. This clarity helps patients understand exactly what is expected of them, which increases confidence and adherence. These metrics are crucial for assessing risk and ensuring safety. For a post-cardiac patient, knowing functional capacity in METs is essential. If a stress test shows a peak of 5 METs, prescribing 6 METs could overtax their system. Use METs to keep training challenging but safe. VO2 and METs provide an objective way to track progress. Moving from 3 to 4.5 METs is a measurable improvement. Numbers motivate, communicate, and elevate care. Now for the practical part, how do we use these concepts to design great programs? The first step, estimate your patient's maximal capacity. Lab VO2 max is the gold standard but often impractical. Use submaximal tests instead. The 6-minute walk test. The 2-minute step test. Various treadmill protocols. These tests estimate VO2 max or peak MET level. Once you have a baseline, you have a starting point. You know the ceiling. Now plan the work beneath it. Think of it as knowing the top floor before designing the staircase. With an estimated max MET, prescribe intensity using a target range, a common approach. Work within 40 to 70% of maximum. Example, estimated max equals 8 METs. Moderate training is 3.2 to 5.6 METs. Give patients a list of activities in that range. Brisk walking, about 3.5 METs. Light stationary cycling, about 5 METs. Water aerobics, around 4 METs. Choice improves adherence. Teach patients to gauge intensity with RPE and link it to METs. Use METs, heart rate percentage, and the RPE scale together. Moderate intensity is RPE 12 to 14, aligning with the 40-70% MET range. Practical drill. Walk at 4 METs. What number is this on a 6 to 20 scale? If they say 13, you have a powerful link. Tell them, great, when you exercise on your own, keep that feeling of 13. The principle of overload is the foundation of all physical training. The body must face a greater stress than it's used to. If you always lift the same weight or walk at the same speed, improvement stalls. To spark adaptation, you must overload the system. This doesn't mean pushing to the absolute limit every session. It means the challenge is slightly greater than comfortable. In PT, overload should be thoughtful and gradual. For a post-op knee, start by moving from non-weight bearing to partial weight bearing. For chronic back pain, increase a plank from 20 seconds to 25 seconds. For a deconditioned older adult, a small speed bump can raise effort from 2.5 to 3 METs. The signal is, we need to get stronger to handle this new demand. Apply overload by increasing intensity, duration, or frequency. More weight or more incline, longer sessions, more days per week. Choose the right dial based on goals and condition. Balance overload with recovery to prevent injury and burnout. Growth happens during rest. The principle of specificity is intuitive. The body adapts specifically to the demands placed on it. In short, you get what you train for. To become a better runner, run. Swimming is great, but it won't improve running like running does. Different muscles, different patterns. Adaptations are activity-specific. One size rarely fits all. Specificity is central to functional rehab. Prescriptions should mirror functional goals. If the goal is lifting a grandchild, mimic that pattern. Deadlifts, front-held squats. For gardening, include squatting, lunging, and twisting. The closer the exercise to the task, the better the carryover. Specificity applies across fitness components. Match stimulus to desired adaptation. Progression is the logical extension of overload. As the body adapts, the stimulus must increase to continue seeing improvements. Progression is planned overload over time. It's a roadmap, not random stress. This ensures steady gains and avoids plateaus. Keep progression gradual. A common guide, no more than 10% per week. Increase from 20 to 22 minutes, not 40. Or bump load slightly, or add a rep or two. Slow and steady minimizes injury while maintaining challenge. On the other side is reversibility. Use it or lose it. Adaptations fade when training stops. Strength, endurance, and mobility decline with inactivity. Patients may drift back to baseline. Communicate this for long-term health. Connect them with sustainable activity. Empower them to own their health. We've covered a lot. Let's bring it together. VO2, METs, and training principles are essential tools. VO2 max is the high-precision measure of the aerobic ceiling. METs are your practical measuring tape for intensity. Overload and specificity make training effective and relevant. Progression sustains gains. Reversibility reminds us to keep moving. Start integrating these today. Look up METs, use submax tests, talk in METs or RPE, and design specific, progressive, safe programs that empower patients and elevate your practice.